I'm gonna just.
This is hazing. I'm just scared of the needle hurting. But once I'm numb, take me from behind, Dr. Tutela. I don't care. I'm going to feel a thing.
You could bring the tip together.
Okay.
And elevate it just a little bit.
Vinny and I will bring our tips together as well.
This is good. Oh. Do you feel fish?
Not yet. Oh.
Now, what did Nana weigh in at? That's the question. Yeah. That's the question.
It looks like passion fruit chia seed.
This is the beating of the minds right now. The big three sitting here.
Pretend you have dementia and start walking around and find the Botox fridge and rob them.
Yes. Okay, everyone, welcome on into Out and About. A quick housekeeping note right now. This episode was not recorded in the studio. Beautiful Studio 1A at Barstool Sports. This was recorded in gorgeous East Hanover, New Jersey at Dr. Tutela's office because Nana is getting herself some hair transplants and Vinny and I were there to document the whole thing. So, why am I telling you this? Because we want you to continue to listen to this for a minute and a half so we get credit on Spotify, Apple, etc. And then jump over to YouTube, Rumble, wherever you like to watch us because it's a very visual episode. Joey gets hair transplants. Vinny and I are there. I interview Dr. Tutela as it's happening. We talk to some of the techs. I tried to do a good job of narrating what was going on. So do listen, but this is really a watch-heavy episode. And we hope you guys enjoy. We're going to try and do some more out-of-the-office stuff like this to spice it up a little bit. Love you all. Enjoy the episode. Goodbye.
Thanks for having me. Nice to meet you.
This is the most Joey thing I've ever been to in my life. I walked in. She's on the desk.
Mm-hmm.
Right?
And Nana's on a mild sedative.
The good thing is, Joey doesn't know this yet. I'm actually going to be the one shaving his head.
I just heard that. And we could just shave here down, and then the rest here.
We can take the lower back.
We could keep that, right?
Yeah, I can work through that.
Or do you want to shave some more recipient?
The recipient is always nice being shaved because it's easier to get the grafts in and without things being in the way. But it's not a lot that I couldn't work. I can work through anything. So are we gonna come all of this?
I think so. Big goals here is all up in here. It's kind of got a little bit of a bald spot.
Big business.
Right, and then just thicken up. Kind of do something like that.
Okay.
And the bald spot?
Not really advancing.
Right, just filling in, just all fill.
And a lot here.
Crown Queen, Botox boss.
What's that?
She's the Crown Queen. She's the Botox boss.
You are?
And Tutela's the head of the titty committee.
So let's...
Alright, I need to see here. So one of the first things we're gonna do is here, scooch back to it.
She had a tick latched onto the back of her head.
I'm getting a 360 lace front installed.
Oh my god, that would be amazing.
And can I just get a
Oh yeah.
Can I get a gauze?
What's that bowl for?
This?
Yeah.
That's your food dish. That's your water dish, you fucking pig.
Can I get a ruler?
And can I get a double egg salad on whole wheat?
We are taking lunch orders actually.
Okay.
So just think about what you want for lunch.
Okay.
For sure. So I'm just marking the hairline right now. This is actually probably, the more important aesthetic decision making that we do, because you want it to still be natural, especially for your age.
Yeah, because it's not going to be completely straight across.
Right. And so what we're going to do is thicken in all of this hair all throughout here, really maintaining the hairline that he has, except just making it more robust. And then over here, he has a bit of a bald spot that really kind of goes in a little deeper, so we're going to really focus on that. So that's going to be great. And then let me have you turn around. Okay, and you can see here, probably the thing that makes him the most self-conscious day to day is this void. So we're going to fill all this in, and then the next thing we're going to do right now is shave down his hair for harvest, and we have a guest hair shaver. So here, you can see this. I'm gonna just hold this.
Okay.
Here. So you're gonna go. You see this square here that we're doing?
Yep.
All the way to here.
Yep.
Okay.
Everything below?
Everything below.
My, how the tables have turned. I'm gonna go up, okay?
Sure. Yeah. Let me just turn it.
There you go. Ooh, this is a good, a good shaver, Joe. You look good. How are you feeling?
I'm very soothed right now.
Uh-huh.
And I'm
What
in
else?
capable hands. I'm just excited to finally start transitioning. I know you're gonna do my tracheal shave right after this, right, Dr. Tutela?
Yeah.
An FFS? I want to be able to wear a snapped pony. Don't go too high.
I'm not.
He's not.
I've done this before.
To your mother's lower back.
To your mother's.
Why aren't you going in the same direction, like finishing one area and then go to another? You're going all over the place.
Joey, I know what I'm doing, okay? I've been doing this for years.
I'm gonna have you turn this one.
Okay.
All right, come step over here.
Do you always let your patients talk back, or is it just sometimes?
Always.
Okay. All right, so we're getting this whole chunk.
All right.
What do we think?
Nice work. Let's take a look. Looks great.
You can catch a buzz off these follicles.
Great. Yeah.
Can you do this side too?
Yeah.
Do you remember when you shaved my pubic area and nipples?
Yes.
That was a nice day.
Yes, I've never seen a bush like that in my life.
And it was literally 13 degrees in there. I was tucked. I was naturally tucked.
I remember we had to go to Home Depot to get garden shears, actually.
Does it look crazy?
No, it's actually like a
Like a hipster,
Travis Kelce.
like a lesbian haircut?
She's liberaling.
Sorry if there's any lesbians in the room. I look like that lesbian from Orange is the New Black, the big bouldering one. Do you know what I'm talking about? Can I just squeeze his balls?
I have a tough time finding them.
Do I get a morphine drip?
And then a Will Doctor shop.
Take a picture of me from the front.
Huh?
I want to see myself from the front.
Yeah, you look normal.
Oh, the draw. I have the hair too. How long does it take to get numbed?
Not long. 10 minutes. 10 minutes.
It starts numbing after 10 minutes?
No, it's just numbing right away, but it's
Oh, really?
a lot of little injections.
Oh, they're little injections. Not to my spine?
Yeah.
Okay.
You don't want a, what's the thing that they put
Now, I had a permanent wave in 1994.
What's the thing that ladies get when they give birth? And you don't want an epidural?
Epidural. I want my epidural. This is hazing.
Yeah, let's get that table way up.
We are in lovely East Hanover, New Jersey right now at the offices of the esteemed Dr. Tutela because Nana is getting her hair transplant. So we are going to document the whole goddamn thing. If you're listening on audio right now, that's great. Stick with us. If not, we was just going over to YouTube because this is going to be a very visual episode and I'm ready to have some fun. Joey, how are you feeling?
Well, they do have Nana on a mild sedative. I'm just hoping that I can get my FFS at the same time.
Yeah.
I'm fine. I'm just scared of the needle hurting. But once I'm numb, it's, take me from behind, Dr. Tutela. I don't care. I'm going to feel a thing.
So I shaved Joey's head like maybe 10 minutes ago.
Do I look cute?
You look alive. You look like you were maybe in a car wreck.
Am I clockable? Can you tell I'm trans?
Yeah, you're definitely spookable. You're definitely clockable. Your ears are covered in white gauze right now. He's got the back of his head completely shaved and marked, the front of his head marked. And I think we're going to do, well, why don't we just have Dr. Tutela tell us what we're going to do right now.
All right. Well, we got his head shaved here to mark out the harvest site. And so right now I'm going to numb him up with just some local anesthetics. It's going to take a few minutes to get everything numbed up. Then we add a little bit of adrenaline back here so it doesn't bleed so much. And then the next really few hours is going to be harvesting. So we'll take each individualized follicle unit one at a time and then take it to the microscope and process it under a microscope and then start planning our transplant, which we already did, like basically the hairline drawings and stuff like that, but then we'll just get to it. It's a pretty long procedure. We'll be here, most of the day.
And you're comfortable with him saying trans, correct?
I am. Question about the numbing. If say I was on a date and I knew I had to take a big one, would I be able to inject that into my anus to not feel the pain?
I don't think I can recommend that.
Okay, thank you.
I'm gonna go ahead and say yes.
Okay. Just leave me a syringe in my handbag before I leave. I have a big weekend.
You have a big weekend. You're taking big ones on a big weekend. This is my first time here. I feel like I'm in the midst of I've heard your name so many times, and I've never Googled
He's famous.
I know what you look like or anything like that. And it's nice to be here because I can finally put a face to the name. So this is lovely right now. So if you're listening on your drive into work right now, just know that Joey's under the knife and he's going through it. But we're in good hands with Dr. Tutela. What's your biggest fear about this, Joey, going forward?
I have no fears because besides bedside manner, I know that he's the best in the biz, and I trust him with my life. Literally, he cut me open like a swordfish on the table, like a whole hog,
a beluga,
slaughtering a whole hog for like 8 hours. So if he can get through that, this is like getting my eyebrows waxed compared to that. So I'm just so excited to be able to wear a snatch side pony again.
It'll look great. Also, while I'm here, I want to see what he can. What would you do with my nose? If this was up to you, how much time do you have?
Crack that beak.
Yeah. Well, what bothers you about it?
I think it's a little large.
Yeah.
A little hump, a little bit of a. He goes, oh yeah, little bit of a droop.
I see that.
Oh my God.
It's got a hook in it.
Okay, you know what?
I mean, you could do, pretty straightforward rhinoplasty, shave the hump, crack the bones, make it thinner up top.
It's like a Saturday night.
You could bring the tip together.
Okay.
And elevate it just a little bit.
Vinny and I will bring our tips together as well.
This is good. We're gonna end up doing a joint surgery.
All right, can they numb me first so we can get this started?
Yeah, we're gonna numb. We're gonna numb.
I'm
gonna keep talking to you guys while he's doing the numbing. Again, I'm just gonna kind of describe what's going on because I realize that some of you will be listening on audio, others will be on video. So Dr. Tutela right now, close your eyes, imagine that you're watching this. Dr. Tutela is on Nana's left side, or as we would call it in the biz, stage right. Dr. Tutela is in a snatched pony himself, looking snatched. Joey is face down on what looks like a massage table. He just reached his hand out to hold my hand. It does make me a little bit uncomfortable. I'll be filing a complaint with HR, but you know what? We'll cross that bridge when we get to it. The needle has entered the side of his head. As we said, it is large, but I know that Nana's taken larger, if we do remember how she was in the 90s. And they're numbing the area right now. I'm not going to lie with you guys. It's like this is pretty intense. The needle is going right in. Now, I did actually switch out the serum with Tina, so he's going to be doing a straight up T-blast into the brain. Now the adrenaline will course. He's trying not to laugh. Don't do like sexual moans.
I'm sorry.
Do a moan like you're climaxing. That might help.
No.
Please don't.
Please don't. Good Lord. So, I don't think I've never really had a procedure done. I have had Botox, Dysport, which I love. I've had the machine that they put on your stomach, which does 20,000 crunches. I actually had that put on my ass, and it gave me a shelf for the summer, which was great. Joey's going through it right now. Oh my God, another needle? And the numbing starts right away, right?
It does. It does. It takes a little minute. What I'm performing is a ring block. So kind of a few different perimeters, and then the inside of that perimeter will be numb. And then we add a little tumescent, which has like some adrenaline in it, which kind of minimizes bleeding.
Will that raise the heart rate?
It can, but usually stays pretty local, so it shouldn't.
Are there different types of adrenaline? So like the adrenaline you'll experience in like a fight or flight will be different than what you're putting into his head, right?
Same idea.
Same idea. I was a medical doctor. back in
So I'm
the
gonna
day.
start swinging at the Crown Queen.
How are you feeling? You okay?
And fine, it just pain in the ass. It hurts.
Yeah.
You know, there is, I will
It's
say
nothing
that,
you're doing. It's the way it is, girls.
No, it's fine. I'm just being a bitch.
what else is new? There's, the moans are sexual. The moans are a little bit like sexual, aren't they?
We have Chelsea, the Botox boss.
Oh yeah, I'm here.
Oh my God. You can shoot me up with some Botox on the way out. I'll love you forever.
Yeah, you're here. Why not?
Why not? Well, there we go. The whole trip is worth it. I can freeze these fucking hot dogs on my head. Get rid of my 11s, get rid of my crow's feet. Do you feel fish?
Not yet. If you grab a gray hair and install it to the front of the hair, is it going to stay gray? Or like, can you grab all the dark ones?
It'll stay gray.
So try to grab the dark ones. Or, you know, blend it in.
Yeah, you don't really have too many grays back there.
Oh. Oh.
This is the worst part of the whole thing.
How many, like, cc's of this stuff are you putting in? What's the unit?
Right now we are coming at about 15,
15.
but we have much more we can use. And then as the day goes on, it kind of wears off, and you could add more. But we have like, as far as a weight-based calculation, we have up to 70. About that, is that right? That we can use.
Now what did
For a
Nana?
large gal like himself.
Now what did Nana? Now what did Nana weigh in at? That's the That's the question.
It's like, we have a tank out back.
Now Nana weighed in at about 6 stone, as much as a small filly or a large Clydesdale. Joe.
How many quadrants we've done?
We're almost done.
Talk to me. What are you feeling?
It's a pinch, and then it's a burn, and then
So.
I'm not. Oh.
I'm sorry, I'm laughing. It is not funny to see when I'm pain. I just
I mean, I
can't.
don't want to deter everyone. Like, you know, this is worth. It's gonna be worth it. It's
Yeah.
Like, this is like nothing compared to what people have to deal with being ridiculed for being bald.
That's A, not where I thought you were going to go with that, and B, that's very true.
Do you know what I mean? I'd rather be
Pain is beauty.
in a luxury tea spa
Right.
getting my head severed than, you know, 50 and single with a bald spot
That's true. And we did
at an all-inclusive resort in the Maldives.
we did clear with Tutela that I went ahead and I did put a DNR on Joey before this happens. we're gonna pull the plug
Pinching here?
if anything happens.
Yeah.
Is it pinch or
Yeah, pinch.
yeah? How about here?
No.
How about here?
No.
How about here?
Yes.
On a 1 to 10, how bad is it?
No, I'm at a 6.
6.
Should I take my pants down?
Please don't.
So the back of the head is where they'll be harvesting the hairs from, and they'll be moving them to the front, and then the back will regrow. When you harvest the hairs, what does that mean? You're just scooping out the follicle?
Yeah.
And do you have to go like deep for that?
I mean, it's not that deep, but you got to get past the root and the follicle. So
How do his follicles look?
they look great.
I can't believe you're not bleeding with how much you drank last night.
But more is smoking. I put 2 cigarettes on each nostril, and then I hotboxed myself.
So no,
I have not been vaping or smoking at all.
no nicotine.
Nothing at all.
allowed.
And then in terms of
And I haven't drank in a month.
post recovery care, Is he allowed to drink or smoke or anything
No.
after?
No,
6 weeks.
no nicotine for at least 6 weeks, and I would really hold off for months. Well, nicotine constricts the blood vessels, and you're putting these hairs, which are very happy right where they are, and you're taking them away from their blood supply and their nourishment, and then you're putting them in a new place, and you are relying on your body to regrow small little blood vessels to those hair follicles in their new home. So if during that
It's almost
time
like
you're choking those, blood vessels from forming with the nicotine, you're gonna just decrease your result.
And does alcohol affect it in a similar way?
No, not really. It's really more the nicotine. Alcohol, people can drink after the procedure. I caution my patients not to get fall down drunk, but you could have, a drink or two. Also, you want to just decide whether or not if you're taking any narcotic pain medicine, then you shouldn't drink.
Right.
But once you're out of that period, which is usually the first couple days, you could have a glass of wine or something like that.
And what about other substances?
No, I'm not going to be doing anything. I'm drinking bone broth.
Is the caffeine the same as nicotine?
Not
For
so
the same
much.
reason? No?
Not so much.
Well, there you go. Now we know what we have to do after this.
Any pain here? Pinching?
I don't feel anything.
No. How about here?
Nothing.
Here?
That's pinched.
Little pinch there.
This might be a crazy question. How do you not just poke his brain? Do you just go in from an angle? It's like a shallow dive.
A little bit.
Oh.
His skull
Okay.
protects his brain.
Got it. Now a skull is
This is the hard,
no, that's the cranium.
bony thing that your brain is in.
My lord.
One of that, and that looks a mess.
Talk to us.
I'm just not looking forward to doing that again later.
Is that pain?
No, it's just like I feel it on my
Yeah.
bone.
So yeah, we're just you let me know if there's any pain still here.
It's just pressure, I feel.
Yeah.
That's the grossest feeling.
And that's just in your life or right now, currently? Are there any risks associated with this procedure? What's the biggest risk?
Infection.
Yeah. I mean, just loss of the grafts. Anytime you make a cut in the skin, you can have an infection. It's pretty low here.
Right.
Any of these injections, you could have an allergic reaction, in which case we would just stop right away, but we're not seeing any evidence of that. But not much, just loss of graft.
So I'm watching him right now load up the back of Joey's skull with saline, and it looks like you'd inflate a water balloon, and it's like these little pockets of saline. It's almost like bumping up the skin. Like if you shave, if you're a guy, and you kind of make an air pocket in the side of your cheek to make it bigger so you can get closer to the hairs. That's what it looks like it's happening right now. Now Nana is bleeding a little bit. But I will say, the doctor has magic hands because he's getting very gentle.
How is that so much pressure?
Okay.
Sorry I stopped talking. I almost just threw up. so stay with us.
Out and About is sponsored by Row. More specifically, Row Sparks, which are a 2-in-1 prescription treatment for stronger, harder erections. They hit the bloodstream faster because they dissolve under your tongue, and getting hard faster means having more sex. After they dissolve, they work in 15 minutes on average. Row Sparks can give guys thicker, longer erections than you usually have because they get fuller. It also gives you the boost to last longer, so it's more fun for both you and your partner. And the best part is Rose stays active in your system for up to 32 hours, so you can go back to back to back, round after round, and you're always going to be ready the morning after for a little bit of fun. So be ready for play with Rose Sparks, and with Rose Sparks, like we said, you will get the erection you've always wanted. Row connects guys with a medical provider, all 100% online, so there's no awkward conversation with in-person providers, and if provided, treatment ships directly to your door. If prescribed, new sexual health patients get $15 off Sparks on a recurring plan. Connect with a provider at row.co/out to find out if prescription Row Sparks are right for you. That's row.co/out for $15 off your first order.
All right, so we're in phase 2 right now. We're harvesting the follicles. Joey is face down, ass up, like he likes to be. I'm standing next to Dr. Tutela, and we have 2 ladies here who are helping out with the procedure, or doing the procedure. Yeah, doctor, tell us what's going on.
So right now, Gloria is, who I work with all the time, is harvesting each follicular unit. This device here basically is like a hollow, let's say, cylinder with a sharp edge to it, and it has suction going on the entire time. And each follicle unit is identified, and then the machine is kind of placed right over it. A little bit of pressure and hydraulic force to kind of spin the blade. A little bit of pressure will get you down to the depth that you need to be, and it will extract each follicle one by one. This suction here sucks the follicles up into the tubing, and let's see where they end up. You can show it there. Yeah. But you can see where they end up. So they'll end up there, and then we'll take them out, harvest them under the microscope, and get them ready for transplantation.
So you're going to do this. He's doing 2,500 of these on the back of his head?
Yeah, about that.
So that's labor intensive. You have to sit there and poke this thing 2,500 times. You have to pay attention to what you're doing. You have to not go in too far. You have to go in the right amount. You have to make sure that the patient is okay. This is overwhelming, and I'm not even involved in it. I'm just standing here watching it happen. They're wiping away blood. This is crazy. What kind of patient is Joey? How did you and Joey first meet?
Me and Joey first met through Nicole.
Yep.
She sent him my way when he was interested in some body contouring and gynecomastia surgery, right, Joey?
Yeah.
How long ago was that? 5 years ago?
2020.
Okay, yeah, so about that, 5 years ago. And we did that. He did great. And we've been, friends ever since. And so, as you were saying, it's very labor intensive. One, strand of hair or a unit of hair at a time. That's why it's great to be able to work with Gloria, who is very, very good at this.
Gloria is focused.
Labor intensive, tedious
God.
task. And so that way, I can be in and out of this room, see some other patients, come back in, make sure everything's going as planned.
And how long will this take, the harvesting?
Really the harvesting, maybe half the day, a few hours for sure. The whole process is kind of a little bit dependent on how many follicle units you're going to transfer. But, you're usually doing about at least 1,500 to, let's say, 3,000. On the upper ends of that, we'll even have a third technician in to help with the processing of the hair and then the reimplantation.
What is harvesting you want to in the microscope? What is it actually doing?
Just kind of cleaning up the edges of the follicle unit, making sure there's no just like pieces of skin that are attached to it that we don't need. Also counting them and then putting them into different categories of, sometimes a follicle unit has one strand of hair with
Category is follicle unit.
follicle unit. And so sometimes the follicle unit has one strand of hair, sometimes it has two, sometimes it has three. And when you're putting it back, you just kind of
use that knowledge to decide, which ones go where.
Got it. Is there a particular, this is probably an inappropriate question. Are there particular like types of people who are hairier than others that you like to work with? Like, is it harder to get to do a hair transplant on like a white dude or versus like a Dominican dude, or is it like?
So in general, just like when you're looking at something,
Yeah.
the best thing is to be able to see contrast.
Okay.
So darker hairs are easier to see than lighter hairs, whether it's blonde or gray or white. So in those cases, we'll actually dye the hair black before we get started here. So we're looking at a little black dot on a white scalp. It's just easier to see.
Got it.
So the more contrast you have, just the easier it is to get through the process.
Joey, do you feel any of this? No. You feel nothing? Nothing. That is the fact that he feels nothing, and I'm watching what's happening going on behind him right now. I don't feel like queasy, but I don't know if I just zoned out while I was watching this, but I'm like, ooh. I don't know how you do this. Is there any particular surgery you do that the first time you did it, you felt a little queasy or grossed out, or you just have an iron stomach?
Yeah, no, that has not happened to me, but it happens all the time in the operating room. Medical students, a lot of times first time they're there and seeing something like that, for sure. I was a medical student once, but that sort of thing I never experienced.
What's the longest surgery you've ever done?
Probably free tissue transfer. And I still do those, although they don't take nearly as long as they
What's it
used
called?
to. Free tissue transfer.
Got it.
So that's when you take, using advanced microscopic techniques and using microvascular repairs, you take a piece of tissue, whether it's skin and fat, or skin, fat, and muscle, or skin, fat, muscle, and bone, from one part of the body, totally detach it, while keeping like a little artery and vein dissected out with it, and moving it to some other part of your body, finding a little artery and vein to basically plug it into, and you do that under an operating microscope. That in training has definitely taken up to 18 hours.
And what kind of procedures, like that's the name of the procedure, but like what is that?
So you can use it for different things. A lot of times, basically, you're using it to reconstruct an area that a cancer surgeon has basically created a hole or taken away something that you wanted. So what I use it for mainly is breast cancer reconstruction. So if a patient has their breast removed, one of the ways to rebuild a breast is to take that patient's skin and fat from their abdomen. And typically like the same skin and fat that you would throw out in a tummy tuck, but instead of throwing it out, you dissect, under advanced microscopic techniques, an artery and a vein that attaches to that skin and fat, and then totally remove it from the abdomen, find an artery and vein right underneath one of your rib cartilages, snip out a little piece of that cartilage to find that artery and vein, plug those two in together, and you'll have a new breast made out of your abdominal skin and fat. And that I do a lot of.
I didn't even think when I came here that would be something that like that side of plastic surgery is not something that I considered. I always considered it, and I guess technically that is cosmetic, but you don't think about all the things that people who have these, life-altering, terrible diseases have to go through after to make themselves, feel comfortable in their body and this and that. So when you remove that skin from someone, is there like it's like a ticking clock, like we got to get this back on so the skin doesn't die?
Yes, definitely. It is time, constraints to it. Yeah. At this point, after, you do the proper training and kind of do it well, and, I'm, part of, maybe a dozen or so plastic surgeons in New Jersey that do this procedure well. It's called the DIEP flap procedure, DIEP flap procedure for breast cancer reconstruction. You get it down where that's not quite an issue. You're not really like fighting the clock so much. I mean, you do have a time constraint, but you're getting it done in a quick enough time that you're not too concerned.
Is there a favorite surgery that you do?
What
do you get most excited over?
Yeah, I would say that procedure, the deep flap procedure for breast cancer reconstruction is probably one of my favorite procedures to do.
Just because
it's
of
so,
the complexity.
Yeah, it's so technically complex. It's so rewarding. A big part of surgery in general is immediate gratification. You're treating something and it's fixed right then and there, as opposed to somebody's high blood pressure or cholesterol where, it takes a while to get that under control. Yeah, exactly. But that is probably one of my favorite surgeries to perform just because of its complexity. I do it in a team of one or two other plastic surgeons that we do it together so we can do it efficiently and well. And another surgery, which is like on the flip side as far as complexity goes, is just a standard breast augmentation. It's quick, it's immediate, patient satisfaction is through the roof. Right. You could do like 4 of them in a day and, really get a lot done. And that's always looks pretty when you're done, at least in my hands, and, always happy to do that surgery.
Do you go in through the belly button for the boobs?
No, I think that's a bad idea.
Okay.
Yeah, I think, it's really got a higher rate of complications. And in general, I like less complications.
Yeah.
So I make a little incision right underneath the breast, which is where the implant's going to go, which is a great place to put it. So that's the way I do it.
I got my appendix out and they went through my belly button, and now my belly button looks all fucked up.
Oh, yeah.
I'm like, what? They didn't tell me that. I have like a deep belly. I have like a big guy's belly button.
Yeah, very interesting.
It's like I could store like an Expo marker in that thing.
Yeah, there's not a lot of things that necessarily come up in managing expectations with different surgeries that you go through sometimes, depending on the surgeon. When I had my appendix out, I was a senior in college, and laparoscopic surgery was still like a little new. I mean, like there were a lot of people doing it, but there were definitely some surgeons that were like just starting, and they had maybe been operating for a long time. So I remember getting wheeled back, and my surgeon asked me, and I'm like 20 years old at the time, he asked me, so do you want me to do this open or laparoscopic? And I'm like, I have fucking no idea basically what you're talking about, but I'm happy I thought of the question was, I said, well, what are you better at? And he said, open. I said, well, open.
Smart.
Yeah.
Can I ask you some rapid fire personal questions?
Sure.
How old are you?
45.
Where are you from?
Short Hills, New Jersey.
Where did you go to school?
So I went to Newark Academy for high school, NYU for undergrad. What's now Rutgers University, New Jersey Medical School in Newark for medical school. Then I trained at St. Vincent's Hospital in Manhattan for general surgery. And St. Vincent's closed at the end of my training. So the whole hospital closed down. I wasn't done with training. So I finished my training, my chief year, and a couple months my 4th year at Yale University, which was great. I did a year of basic science research at NYU Institute of Reconstructive Plastic Surgery lab. And then I went to the University of Louisville in Kentucky for my plastic surgery training for 3 years, which was fantastic. And then that's it. Opened up my practice in 2014, solo practice. And I've been doing this ever since.
Good Lord, I'm tired just from hearing all that schooling. How you went right into a solo practice? Did you work for someone first?
No.
You didn't. How did you get clients?
Well, you kind of get on the ER schedule. So you start seeing some people in the ER. My brother...
Wait, but you see people in the ER, but you were solo practice? How does that work?
So you just get on the call schedule. So
okay, got it.
When it's your day, somebody comes into the ER, they call you.
They got a broken arm, you say, well, while you're here, let's lift those titties, huh?
Yeah. It's usually facial trauma or something like that, a dog bite.
Okay, well, I'm a jerk.
And then my brother is an ophthalmologist. So I'm actually...
Oh, wow.
I'm from a line of surgeons and physicians. My father was a plastic surgeon. His father was a general practitioner. They used to do small operations.
Did you always want to be a plastic surgeon?
Yeah, for sure.
Do other doctors not look down on plastic surgeon, but is there a stigma like, oh, well, I'm an ophthalmologist, well, I'm a vascular surgeon, I'm this, oh, well, he's a plastic surgeon. Is there that at all?
I think in general, all specialties kind of have, their bias towards themselves.
Right.
But definitely in training and while I was studying as a medical student, there were certain scenarios where you definitely didn't want to tell them that's what you wanted to do because it is looked down upon, and it's mainly from the cosmetic side of things. They think, instead of, operating on somebody who really needs an operation, you're doing something else. And the reality is it's really just not really thinking about the reconstructive aspect, which we were just talking about. But as far as technical advances, like I was saying, with the reconstructive aspects, we do some of the most complex surgeries there are. Not every plastic surgeon does that, but I do, and I enjoy doing that as part of my practice for sure.
Again, kind of a personal question, do plastic surgeons typically make more money than other types of surgeons? Is that a driving factor for people to go into plastic surgery?
I think that is true. A lot of the specialties in general and specialty surgeries, you're always going to make a little bit more money,
Right.
So a lot of people go into it for that. I wanted to be a plastic surgeon before I even knew what it was, just because that's what my dad did.
Yeah.
So.
Well, your dad was a plastic surgeon.
dad was
I thought you said your dad was something else.
Yeah, no, my dad was a plastic surgeon. His father was a general practitioner. My two brothers are surgeons.
So he must have seen, the amount of technology that's changed from when he started to now must be insane.
Yeah. I mean, a lot of advances in medicine and surgery. Really, the big thing that happened, while he was still in practice, he's passed away now, are injectables. So Botox and filler and stuff like that, when that first came out.
Right here, I got these hot dogs.
Oh, nice.
Shoot me up, Doc.
We could definitely do that.
All right.
And so we, those injectables, when they first came out, I think he was just trying to get his mind wrapped around, like, are we really doing this? Like, this is not an operation at all. But,
Well, the
so
stigma that you experience, like, oh, I'm going to plastic surgery, that too has probably subsided because now it's so much more common. People have, it's cheaper, it's more common, people have money to do it, and also it's something that is not really looked down upon. I remember when it was, you remember when weight loss surgery started? Sure. Oh my God, I saw Wendy Williams' viral clip. You cheated on weight loss surgery. That was a big thing.
Sure.
And now everyone gets weight loss surgery, everyone gets Botox. So that's probably driven people to you.
Yeah, absolutely.
Yeah.
So in my era, there's social media. People are talking about what they're having done, showing off the results. If you look
Vlogging it on the Out and About YouTube.
If you look at my Instagram page, most of it is patient selfies showing off their procedure.
Yeah.
In my dad's era, I mean, there was this huge stigma with plastic surgery that people were just not talking about it, and wanted it not to be, known that they had it done.
Have you ever had to turn someone down? Have they wanted to have something done that was so over the top that you're like, I'm not comfortable doing this?
Not really. I mean, there might be a few patients that have come in that really just weren't good candidates. You could tell their expectations were way off from anything reasonable.
And you'll turn them down.
Yeah. It can be a little bit of a dance to turn somebody down and not offend them. But it definitely is part of practicing.
It's interesting. All right, so what's going on with Joey now? How are we looking?
Ladies and fellas, let's talk about the elephant in the room. Erectile dysfunction. 1 in 4 men 18 years and older experience ED, which means that you or someone close to you might be experiencing it. Listen, I'm not going to lie. I've experienced it from time to time, and I wish I had something like Eroxon to help me out, and now I do, which is why I want to tell you about this new ED treatment gel called Eroxon. It's the first ED treatment gel with clinically proven results that you can get over the counter, and while it may not work for everyone, studies have showed success in over 60% of men, and that's something that I'm willing to bet on. The best part, no prescriptions or online questionnaires needed. So why wait? Try Eroxon today, available in stores and online. Visit eroxon.us to learn more. We're breaking the silence on erectile dysfunction on this show, and I'll tell you what else. I'm going to break the silence right now on a hot take that I had on Twitter, and this goes all the way back to Sunday when the SNL 50 happened. I tweeted out, I would be okay never hearing another Hamilton song again in my life. And I'm going to stick by that. I'm breaking the silence for, I think, the majority of people when I say that Hamilton is done. It's over. It was never cool. It had a moment for about 10 minutes when it first came out. And now it just reads desperate. It reads safe space. enough. Please stop shoving this down our throats. It's time to move on from the rapping about historical figures in Hamilton. I'm over it. That's what I'm breaking the silence on. Don't get mad at me, but it's true. Vinny, what's your breaking the silence?
Before I do that, I agree with that, but it just Broadway in general, I do think it's strange that the shows they never end. Like the original cast will be gone. They'll still do the show for like years. And it's just, I don't know why they don't just do the run and then the show stops.
Listen, I'm going to disagree with you.
Really?
I think if a show is on and the show is good, you got to keep going. You have to keep
but
going.
Even if it's not the original cast anymore that it was?
I don't think a lot of the cast uses it to like catapult themselves into other careers, I guess, but it's not like, Alex Cooper catapulting herself from Barstool. These people kind of catapult themselves into like obscurity. It's like if you're a big actor, I can only name 3 or 4 big actors or actresses from Broadway. There's Kristen Chenoweth. There's...
I know that is.
Dua Lipa.
Dua Lipa?
No, there's Lin-Manuel Miranda, who's still clinging on to the Hamilton. Enough with the Hamilton. And then you guys are going to kill me. If you know who
I don't know.
Are other big Broadway actors. But I know like the Nathan Lanes and like the classic Broadway actors.
Like I haven't seen Book of Mormon, but like if I haven't seen it yet, if it's still on, I feel like I'm not going to go at this point. Like, why is it like people are still going to it?
I think the difference are those shows are so well written and th're so much of a well-oiled machine that it's like plug and play. That's why Broadway shows, Cola Scola, Oh Mary. If you're ever in New York, you need to see a show. Go see Oh Mary if it's still on. It's unbelievable. It's about Mary Todd Lincoln, the drunk wife of Abraham Lincoln.
I guess also like there's a lot of tourism here. So like I'm saying that as someone who lives around here, but people visiting.
I also can't fit in the seats. Like I literally can't not. The old me would have mentioned your height right here, but I'm not. You got flamed on that Instagram page.
All my friends were sending me like on Twitter. People were like, "Dude, you're getting flamed on Twitter." I was like, "It's way worse than Instagram."
We got to take pictures more. That was fun watching you.
That was an optical illusion. I'm not that short.
Yeah, Vinny's 6 feet. We were on a hill.
I'm not tall, but I'm not that short.
Well, you could fit in a Broadway thing.
Yes,
you got no excuse not to go to Broadway.
That's true. My breaking the silence is, I don't know if you're able to make citizens arrests, but I think in New York City you should be able to make citizens arrests for people who block the subway when you're trying to get off, stand on the left side of the escalator, or block the stairs getting out of the subway. I think I should be able to arrest them on the spot.
How would you citizens arrest?
Just say it. And then they're just like, fuck, I'm arrested.
And then you just turn them around and arrest them.
Yes, and they just have to comply because I just yelled it.
All right, that's fair. No, that's a good breaking the silence. Yeah, I can't disagree. Although I do go up the stairs on the wrong side. Like if it's faster.
You can go up the stairs, but do you stand on it?
No.
That's what I'm saying. People stand and block it so you can't walk up. Like they'll be the only person blocking. If you're the only person blocking the escalator, how do you not realize it?
The people who are blocking those are usually have like mental issues.
No, that's not true.
I don't know. Well, now in the subway in New York, they have people stand and watch to see whether you jump the gate or not. There's this one lady on 14th Street where I get on who is the most fabulous woman I've ever seen. She's dressed to the nines with a little MTA vest on, and her job is to just, I feel like I know her because every time I walk by, I say hi. Her job is just make sure people don't jump.
That's one of the biggest Karen things about me is it does bother me when people jump the turnstile. Like,
she should make sure that people don't block.
That's what that should also be part of their job. I agree with that.
Add to the job description.
Yes.
MTA fare hikes. Redirect the money to our girl at the top of the stairs.
I'd pay extra in taxes for that if they would police it properly.
If you guys are listening to this right now, I do want to go ahead and direct you on over to the YouTube because this episode is a little different. If the audio quality is not there, I don't really care because we had so much fun doing this episode. Joey's getting hair transplants. It was much more involved than I thought. I did feel nauseous on the way home because I saw all the blood. Literally, I was doing the thing where I was in the car and I was squeezing right here to make myself not nauseous.
That's a thing. I didn't know that.
Big trick. Time. Yeah, and I had to roll the window down, take my headphones out. But my blood sugars could have been low, so that could have been what it was. But if you're listening to this, make sure you watch it. We're going to try and do more weird shit like that. And by weird shit, I mean every time Joey and I have a procedure, we're going to document it so we can get it for free. What'd you think?
I thought it went well. I think Joey's going to have a beautiful head of hair pretty soon. Dr. Tutela was nice. Dropped a lot of knowledge.
All right.
Yeah.
Good.
I think Joey's going to look great.
Well, is this an outro?
No. This is going to go right back into it.
All right. Well, we're going to get back into the show right now. Love you all.
Yeah, so here, it's just more of the same. And that's how most of this morning is going to go. So she's got, do we have a count on how many are harvested? 375. out of our target is going to be about 2,000, maybe a little bit more than that. But as you could tell, we got a long way to go of just this.
Wow. And are the people who, you got, ladies, have to remind me of your names again. I'm so sorry. Michelle. And Gloria. And you guys are nurses or like what do you do?
I'm a surgical technician.
Surgical technician. Surgical technician esthetician. Got it. Man, this is like I said, if you're listening right now, and I could talk to Dr. Tutela all day. That was fascinating. If you're listening right now, make sure you check us out on YouTube, Rumble, wherever you can watch this stuff. Because if you've never seen a hair transplant taking place, it doesn't like look that bad, but when you think about what's happening, and you're like, okay, they're just doing all these little pinpricks on his head, but when you multiply that by 2,500, it's like, it's probably gonna be a lot. And we watched the Wonton Don's YouTube. I've been catching up on that bald stool where all the guys went over to Turkey and did their thing, and they had like Ken Jack. We love Ken Jack, the Lights Camera podcast guy at Barstool. That motherfucker was bald as could be, and his entire head got done. Donnie's head got done. Rudy's head got done. So it seems as if there's quite the wide spectrum, just like sexuality, of how much of a hair transplant you actually need and what kind of results you want. Joey, how are you feeling?
I'm fine.
You good? Are you numb?
Yeah.
Are you tired?
No, I could be more tired. It's just monotonous.
So normally we have like a cup that hooks onto this, and the grafts go in here and they get washed with the saline. But I don't like using that. Sometimes it gets clogged, and so I'll direct it straight to the bottle, which they're good because they're in saline and his natural fluid.
It looks like Hawaiian Punch.
It looks like passion fruit chia seed drink.
Take it down, Joe.
No, they still got to count those. Those are expensive. Each follicle's.
I'll take these and I'll put them under the microscope. That's where I dissect them and I count them all to make sure we have.
Do you tell guys at bars that you're a scientist sometimes?
Maybe.
I would too. I'd be like, what do you do? It's like, well, it's very intense.
So while she's doing that, I'll just kind of wait for her to get them out and bring me the bottle back, and I'll continue, and she'll process over there. Yeah. So it's all continuation flow. It's a long day, so everything's hurry up, get rid of grass, keep going. Plus the grass, we have to keep them on ice.
Yeah, they have to stay on ice.
And saline, so we try to, get them out and get them back in as fast as we can.
Good Lord. Joey, what's going through your head right now, babe? Talk to me.
Nothing. Is my head all bloody?
Yes. It's very.
Take a picture.
I don't want to show you.
Is it gross?
Yeah.
It's a little gross, but it's like
I'll show you.
What I would expect it to look like. It's not crazy.
It's not that bad now.
Yeah, that's fine.
Oh.
And she's got chicken pox.
So she's just harvested.
I know. Oh, it is? Poppy had to bring me eye pills.
Oh, my Lord. What's up, Poppy? Those are a lot of pills. Good to see you.
Came to save the day.
Came to save the day. Poppy's here. What did you bring in, Poppy?
Brought us all his pills. Look at this here. There's 10. There's 10 bags. And this, I had to hide the diazepam. People wanted it. Well, that's.
Oh, careful.
Yeah.
Is that going to fuck up your bleeding?
This is hit from the doctor. I took him this morning, but I didn't take him out.
Oh.
That's what he wants me to take, or he wants me to take the other one?
He didn't tell me. He texted me. Let me see what he texted me.
You want me to go find them? I think.
Yes, ask him what I should take. I just want to
Just bring
relax
them
and lay
all.
down.
He will
I also have
sort through
Xanax
them.
with
He
me.
said, bring them all. He will sort through them.
I also have Xanax tomorrow.
Look at these pills.
I just want to go to bed. I don't want to be up for this. It's
Your
so
dog's
annoying.
fine. Don't worry about it.
Why, you shit again?
No, he didn't do nothing.
Did he eat?
Yeah,
What did he eat?
he's eating. I don't know. Bill
She's a
Bar.
scientist.
Hi.
Hi.
Thank you.
This is the meeting of the minds right now. The big three sitting
This is what it
here.
takes to keep this whole operation running.
Oh.
I have to stay up on my shit. I can't be caught slacking. I need my titties tight and high.
Give me a little couple.
Girl, back up.
Give me some.
Take one from the jar.
You can have one follicle.
Can I probably have one implant? Go pretend you're pretend you have dementia and start walking around and find the Botox fridge and rob them.
Yes. Go put your handbag in the fridge and then take the thing out.
I don't have to bring sheets in my car for my seats.
I'm not gonna be laying back in the car.
Last time you had surgery, you bled all over the place. Remember? The
Where
white sheets.
did he bleed?
All over the sheets at the Archer Hotel. Me and Snooki had to wash his sheets in the sink. All the blood.
Did they?
And I squeezed all my wounds out into the shower. It was like pissing fluid and blood out of my stomach.
It was all white. Everything was every blooded. We had it in the. Oh, it's disgusting. Nasty.
He's staying at your house tonight?
Yeah.
Are you going to take? How is he as a patient? Is he easy to take care of?
Yeah. Unless he has Diet Coke in the refrigerator, that's all we have in this soda and water. Has to be ice cold. That's how he spits.
He has a fit? What's he? Well, you're good. What's he usually have? What's his biggest fit that he usually has when he's at home?
If there's no cold stuff in the refrigerator.
Really?
He doesn't like ice. Okay.
Oh, he likes ice. He doesn't. What do you?
Are you able to eat tonight?
What?
Are you able to eat tonight? You want me? Because I have to go to the Elks at 7:30.
He's gonna vote.
I have to vote for our new ER lady.
You are?
Yeah, and now they're both fighting. Oh, there's two fighting people calling me up fighting. They don't want me to vote for this. Want me?
What's the ER? What's that?
Exalted ruler.
What's that?
In charge of the Elks, like the president of the Elks Club.
Elks Club.
Yeah.
Could you tell him you could be bought?
Yeah, I could be bought.
Free
I
membership?
I just go there to drink. I don't care anything about the Elks.
They still have. I drank at an Elks Club in Wyoming.
$4 a Tanqueray tonics. Okay.
Yeah. Okay. They have like $2 beers at the Elks Club. It's great. Right across from the VFW on Pond Street, 02038, baby. All right. Well, Dr. Tutela had to run to go help out a patient, and Joey is still under the knife right now. So we're going to take off because this procedure is going to last all day. So the next time we see old Nana, he's going to maybe not look the best, but he's going to be well on the way to having a head full of hair. It's going to be awesome. It's going to be great. Thank everyone for sticking along. If you listen to this show, make sure you watch it on YouTube because it sure is something. Joey, any final thoughts?
Nope.
No final thoughts for Joey. And if you like this more vlog style stuff, let us know in the comments and we'll do more of them. Goodbye, everyone. Have a great weekend. Love you.